What drug comes to your mind when you think of megaloblastic anemia and gingival hyperplasia? I do hope you're thinking about phenytoin. You have to remember that step 2 might not even tell you that a patient is taking phenytoin, when in fact they just might tell you that they have a history of a seizure disorder. The way that phenytoin causes folic acid deficiency is because it reduces absorption of folic acid in the jejunum. Cells that really undergo rapid turnover, like hematological cells, really need folate in order to properly have purine and thymidine synthesis. What do you get as a result of this? Well, megaloblastic anemia. What do you look for a megaloblastic anemia? Macrocytosis and hypersegmented neutrophils. Even though step 2 is moving away from word recognition, you see macrocytosis and hypersegmented neutrophils immediately start thinking about megaloblastic anemia. The reason why your gums and gingival area has overgrowth and hyperplasia is because folic acid is used to impair collagenase, and without collagenase you have excess collagen and a buildup of the gingival matrix. How do you stop this? Well, you guessed it, you give the patient folic acid supplementation. Now let's say that the answers don't include folic acid supplementation. Let's say that we give the patient a proper treatment. What other additional things do you give the patient? Don't forget to give the patient calcium and vitamin D. The reason is because phenytoin also will disrupt the bone and mineral metabolism of the body. Now that we're in the topic of megaloblastic anemias, what other drugs can cause this? Methotrexate, pyrimethamine, and trimethoprim. Don't mix this up with microcytic anemia. This is caused by iron deficiency, and you will not have any gingival changes. Let's talk about 3 more very important B vitamins: B1, B6, and B12. B1, look for a question stem that talks about a patient that drinks in excess. This causes Wernicke encephalopathy, and these patients will have gait changes, ocular motor changes, and they'll act very confused. B6 is really tested when you're giving a patient isoniazid for tuberculosis therapy, and remember that this causes that stocking glove peripheral neuropathy. And lastly, B12. This causes megaloblastic anemia, but again, it doesn't cause gingival hyperplasia. It also takes a really long time for vitamin B12 deficiency to take effect.